Hello everyone. In this video, I am going to discuss about the consonants and its classification. So what is a consonant? The word consonant has been derived from the Latin word consonantum, which means the sound produced with the help of some other sound. A consonant is a letter of the alphabet that represents a basic speech sound produced by obstructing the breath in the vocal tract. All the letters in the alphabet, apart from the vowels, are known as consonants. There are 24 consonant sounds in English. Some are voiced and some are voiceless. So consonantal sounds are classified on the basis of voicing, place of articulation, and manner of articulation. So first we will take voicing. On the basis of voicing, sound can be classified into two categories, voiced and voiceless. Some consonant sounds are voiced and some are voiceless. A voiceless sound is one that just uses air to make the sound and not the voice. And you can also tell if a sound is voiced or not by putting your hand gently on your throat. When you say a sound and you feel a vibration, then it's a voiced sound. Whereas when you say a sound and you doesn't feel any vibration, then it's a voiceless sound. So here is the image of voiced consonants and voiceless consonants. And in the voiced consonants, we have b, d, g, j, l, m, n, r, z, d, v, w, y, z. And in the voiceless consonants, we have ch, f, k, p, s, sh, t, th. So this th is the in the voiced consonants, and in this th is th in the voiceless consonant. The is that, th is thing. So this is the place of articulation. The place of articulation is the point of contact where an obstruction occurs in the vocal tract between an active moving articulator and a passive articulator. The manner of articulation gives the consonant its distinctive sound. The place of articulation, the speech organs are primarily involved in the production of a particular sound. These speech organs modify the airstream that is pushed up by the lungs, and this process produces different sounds. The place where the airstream is obstructed is further more significant for the exact production of sounds. Here is the image of the classification of English consonants according to the place of articulation. So we have dental, labiodental, bilabial, alveolar, post-alveolar, palatal, velar, and glottal. In the dental classification, we use teeth and tip of the tongue. Teeth and tip of the tongue as the articulators. In labiodental, we use lower lip and upper teeth. In the bilabial, we use upper lip and lower lip. In the alveolar, we use teeth ridge, tip, and blade of the tongue. In the post-alveolar, we use hard palate and tip of the tongue. In the palatal, we use hard palate and front of the tongue. In the velar, we use soft palate and back of the tongue. In the glottal, we use glottis, which is situated in the vocal cords. So bilabial, in which we use upper and lower lip as an articulator. Consonants occur when you block or constrict airflow out of the mouth by bringing your lips together, as like per as in purse and rap, bur as in back and cab, mer as in mad and clam. The labiodental consonants occur when you block or constrict airflow by curling your lower lip back and raising it to touch your upper row of teeth, like fur as in fro and calf, fur as in wine and have. Next is the dental, in which we use teeth and tip of the tongue. So dental consonants occur when you block or constrict airflow by placing your slimy tongue against your upper teeth, like th as in thick and bad, and the as in the and rather. Next is the alveolar, in which we use teeth ridge and tip and blade of the tongue as an articulator. The alveolar ridge is where your teeth meets your gums. You create alveolar consonants when you raise your tongue to the alveolar ridge to block or constrict airflow, like no as in no and man, t as in tab and rat, d as in dip and bat, s as in suit and bus, z as in zit and chess, l as in luck and fully. When you retract your tongue back just a bit from the alveolar ridge, the sounds change enough to be recognized as distinct consonants. So post-alveolar consonants are those that occur when the tongue blocks or constricts airflow at the point just beyond the alveolar ridge, like sh as in short and brash, z as in wizen and measer, ch as in chip or match, j as in jam or badge. The roof of your mouth is the hard palate, and you create palatal consonants when you raise the tongue to this point and constrict airflow, like yo as in yes. Next is the velar, and behind your hard palate, you have the velum or soft palate. Unlike the bony hard palate in front of it, this consists of soft mucousy tissue. You make velar consonants when you raise the back of your tongue to the velum to block or restrict airflow, like as in going and uncle, k as in kite and back, g as in good and bug, w as in wet. Last is the glottal classification. The glottis is actually two vocal folds. It acts as a sort of bottle cap to your windpipe. Inhale and then hold your breath for a few seconds while keeping your mouth open. What you're actually doing to keep the air from expelling out of your lungs by closing your glottis. Glottal consonants are not actually consonants. They just play consonant roles in the language, like her as in high and Bahamas. Say these words and you notice how you are not actually constructing or blocking airflow for this her sound. Okay, so that's all about the voicing and place of articulation. In the next video, we will talk about the manner of articulation. Thank you.